We're from Birmingham Cross City, CCG, and we started 18 months ago as a direct quality team for CHC. So we were directly involved in nursing homes and the monitoring of quality there. My role is Clinical Quality Monitoring Officer for Continuing Healthcare, which basically means auditing quality nursing homes. As a direct quality team, we feel it's really important to both support the nursing homes as well as audit them. So we have been involved in direct training, offering resources. So again, it was good to be involved in developing specific resources. And because we'd got that relationship with our nursing homes, they were quite eager to participate with us and to be included. It has taken off enormously. Even homes that haven't been involved in the pilot have recognised the importance of hydration. We've had a lot of homes that have implemented hydration champions amongst their carers. There are schemes whereby the fluid intake now is put on handover sheet, so every day the nurse in charge is aware of the fluid intake of their residents. Any residents that have not received at least 1,000 mils of fluid in that day, we're not talking about foods, but just plain fluid in that day, will go onto a hydration list. That hydration list is given to a senior carer who then does hourly fluids for that resident, for all the residents that haven't received 1,000 mils. We are aware that sometimes residents deteriorate to the stage whereby they don't take 1,000 mils a day consistently, but what we've asked them to do following the Think Kidneys recommendation is to approach the GP. He will then decide whether he wants to investigate for AKI with the creatinine levels or whether he wants to do a medication review for the nephrotoxic drugs. If the GP feels that that wouldn't be beneficial for the resident, he will then say to the nursing home, this isn't appropriate. That can trigger the nursing home's holistic approach then to end-of-life care. We're getting a smoother, bigger picture. Once somebody stops drinking, stops eating, and becomes chronically dehydrated, we know as clinicians they are going to go into multiple organ failure. So to prepare a family for what is about to happen, we can start having those conversations early. We can have that hospital avoidance and we can get their preferred priorities of care. So the Think Kidneys campaign has actually promoted a more holistic view of end of life and final care in nursing homes.
In order to ensure that all our staff are trained to the high standards on a monthly basis, we have it on a rolling programme. We've also attached the course onto our mandatory 2-day course. So at the end of our mandatory training on the second day, we receive Think Kidneys / Why Do I Need Rehydration training. We feel that this is a benefit not just to the staff and the service users, but to us as a whole, as a home. We also provide information to our student nurses from the Wolverhampton University, and they're also invited to come to the training, as well as our Wilson Stewart students as well. We use this training in order to train our Wilson Stewart students up, which is our local complex school, and they come and they help rehydrate service users as well. So it's not just training that we've used in-house with our staff, we also use it for our volunteers. Our relatives have also come to the training, and we also talk about Think Kidneys and the training and the reason for the jellies and the ice creams in our relatives meetings. As a whole, this training hasn't just been a benefit to the home and the staff, but also to the relatives of outside agencies and local schools.
We were invited to the initial start event whereby Think Kidneys came to Birmingham and invited care homes. So we joined in that event and took up the opportunity to pilot and be involved in developing some resources for care homes. We thought this would be very valuable as we have nursing home background and to a good relationship with all of our nursing homes, that we actually wanted to invite them to develop those resources, and they took us upon that really well.
We've decreased our urinary tract infections, we have decreased our chest infections. We have incorporated the relatives so that they are aware of the reasons why fluids are so very important. If we have somebody that's very poorly and will not take fluids for us because we have many different service users in the home, we use jellies and ice creams as a source to get fluid down them as well. We talk about the reasoning behind this. Fluid is not just liquid. We can also use products that contain fluid, which was something we didn't really think of in the past. We have our Think Kidney posters up in the lifts, in the main reception area, in our staff room. The reason why they're not just located in the staff room is we felt it was very important for our relatives and service users to be part of this pilot scheme. This pilot scheme, in our eyes, was not just set up for the staff, it was set up for us as a whole. We are a family, and that's the reason why we've introduced it as a family.
It was great to be involved with such a multidisciplinary team developing the resources. People from all over the country on the conference calls, the input, the feedback that we all had, the fact that we got the resources to look through for a couple of weeks beforehand, how the different people approach different things. But everybody respected that nursing home input and how people understood that we had to develop resources that were practical for nursing homes. There are so many hydration resources that are developed for the acute sector that are just inappropriate for nursing homes. So to engage the nursing homes and develop a product that they would use, we had to ensure that they were consulted, and it was great to see professionals listening to nursing homes.